In patients with a history of uncomplicated myocardial infarction, beta blocker therapy is a standard of care. However, the appropriate treatment duration is unknown, and some evidence indicates no benefit of long-term use. A recent trial examined whether the interruption of long-term beta blocker therapy was safe and might improve quality of life in these patients. In this multicenter open-label randomized non-inferiority trial, 3,698 patients with a history of myocardial infarction, no cardiac event within the past 6 months, and a left ventricular ejection fraction of at least 40% were assigned to interruption or continuation of beta blocker therapy. During a median follow-up of 2.9 years, the primary endpoint, a composite of death, non-fatal myocardial infarction, non-fatal stroke, or hospitalization for cardiovascular reasons, occurred in 24% of the patients in the interruption group and 21% of those in the continuation group. This difference did not meet the criterion for non-inferiority of beta blocker interruption to beta blocker continuation. The main secondary endpoint, quality of life, did not appear to improve with beta blocker interruption. The authors conclude that in patients with a history of myocardial infarction, interruption of long-term beta blocker treatment was not shown to be non-inferior to a strategy of beta blocker continuation with respect to a composite outcome of death, non-fatal myocardial infarction, non-fatal stroke, or hospitalization for cardiovascular reasons. Nor did it seem to improve the patient's quality of life. Full trial results are available at NEJM.org.